of the ERP system. But apart from that, they have the need to manage their daily operations also. They have a different kind of limitations or the issues or bottleneck, we can say, where that streamlining their daily operations are the major issues. In each and every ERP system, or we can say that in any of the ERP system, you will not find the solution to manage daily workflow of the hospital, like OPD, IPD, surgery, and so on. If we go for any EHR, in the EHR you will get that all the solutions to manage the appointments or the transactions related to the hospital and so on. But over there you do not get the functionality to manage the ERP flows, like the accounting, stock, sell, invoicing, and so on, HR management obviously. So to overcome that issues, we have implemented this solution on top of Odoo. So with this solution, we can say that we get the benefits of all the ERP features which are available in by default Odoo. And using this, we can enhance the efficiency of hospital operations, daily needs, their transactions. Basically, that if we are managing any hospital, they have the limitation or the issues to manage their resources efficiently, because the communication between two different departments are not easy in the hospital because of their different needs. So to overcome that issues, we have implemented our solution. In our solution, we have implemented different modular structures. So based on the size of hospital, based on the size of the expectation of the customer, we can implement the solution without having major customization. So what we have implemented is that you can see on the screen that we have the multiple modules where we can manage easily all the EHR data. EHR data in the sense all the electronic records. Over here when I say that EHR, it's the same HMS or HIMS. Differently people say they with a different name, but solution or the expectations are the same. So we can manage all the patient details with a single click. If we are managing any patient, we can see easily all their previous appointments, prescriptions, medications, surgeries. At the same place, you can see that which insurance policies they are having. So based on that, you can plan out your further transactions also. If we are managing the OPD or IPD also, then for the IPD, we can manage the availability of the beds and so on. So here we have the different modules where we manage the different functionalities. We have the module to manage the emergency also. So if you are managing the emergency in your hospital, we can manage that hospitalization of that patient in the trauma care center, we can say. First that you will be handled at the emergency center, where over there we give the basic treatments and so on. Then after that only the patient gets hospitalized. So for such a flow also we have the module of the emergency. You can manage all the services of your hospital, whichever we are offering as a hospital, at a single place. You do not need to jump in the different places to get the pricing and the related stuff. At a single place you can see all the services. You can use the price list to offer the different prices based on your insurance companies or based on your corporate types and so on. So from the single place you have that option. Apart from that, we have the option to manage all the medicines throughout the hospital. So normally when you are using any solution, what happens that you have the medicine list separately, and then the medication or the medicine list in the pharmacies are different. The doctor cannot see that what stock is available in the pharmacy. So to overcome that, we have this solution where you can, as a doctor, you can see all the medicines which are available when they are prescribing the prescription. They can check the availability, they can check the alternative products and so on. And when they are prescribing any prescription to any patient, that prescription goes totally digital. It is not like old school guys or that you need to print out or give that prescription to the patient. We go totally paperless, or we can say the digital. Here doctor prescribes the prescription, that prescription will be available in the pharmacy directly. They do not need to print it. Even though if that patient is not willing to take the medicine from the connected pharmacy, then you can send that prescription via WhatsApp or via email also. So these are the digital options which we have. Over here when we talk about the appointment, it is like the OPD. Okay, so that OPD flow is there, integrated OPD flow with the prescription, as we mentioned. We have the separate module for the vaccination also. During the corona time, that was the maximum need of the world, that how we manage the vaccination in our hospital and so on. So we have a separate module for the vaccination, which is getting used for the baby care hospitals and the pet care hospitals also, where the vaccination need is maximum. Our solution is available for the pet care also. After that, we can manage the surgery. So we have the module to manage the surgeries, where we can manage all the surgeries planning also. We have the templates. So it is not like that in the advance you need to mention that what surgery will be there and which kind of medication will be needed. After the medication or the surgery, what will be the medication or the IPD that request will be there for the medicine. And after that, when we are discharging the patient, there will be the discharge also, discharge card. So for all those process of the surgery, we can combine it at single place and we can get it. After that, we have a IPD. Normally when we talk about the surgeries, it happens that can be managed with the hospitals where they have a IPD. But nowadays it happens that there is a single day surgery also, where they do not have IPD or the possibilities to take care or manage the patients in their hospital. But they just do the surgery of the patient and the discharge at the end of the day. So for that kind of the surgeries also, we can manage our solution without a hospitalization. You can directly create an appointment or the encounter of the patient and then plan out the surgeries and complete the surgery, and the discharge card can be generated for the set. The next part is the OT booking. As we mentioned that one of the limitations for the hospital management system is that managing the or utilizing the resources, that how we utilize all the resources available. Because hospitals have all the facilities, all the options, all the resources, but utilization is not up to mark, or it is not possible also to plan it out in the advance. Just the reason is that doctors are always in hurry. Doctors have a different emergencies also. If the doctor is doing the OPD at the same time, if any emergency comes or any accident case comes, they need to go to the surgery or other operation. So to overcome that issues and so on, we can manage the planning of the appointments and OT bookings in advance also. So we can utilize the resources. It is not like that everything will be blocked, so if we have planned any surgery in advance, then we cannot change the date or we cannot plan out any other surgery. It is totally dynamic. Based on the need, we can plan multiple surgeries, or based on the capacity of the OT room, we can plan it out in advance. We can have the register to print it out and we can check it out at the OT room place, so they can check it out that which are the surgeries which are going to be performed today. After that, we have the nursing module, where we can manage all the nursing operations. Basically, that when any patient is hospitalized or the hospitalization is done, that time they need to visit the patient and they need to take the vital information of the patient, that how is everything going on, what is the condition of the patient. So for that, we have this nursing module. Nursing module is only not useful for the hospitalization, but we can use that module for the appointments also. So let's say that we can take the example of the OPD. In the case of the OPD, that patient walks into the hospital, then after that, before consulting with the doctor, we can have a nursing station where they will be going and nurses will be taking the vital information from them. So doctor can save the time. So for that use case also, we use the nursing module. Then we have the integrated laboratory system also. So from the encounter or appointment to the hospitalization, when any patient is hospitalized and different reports are needed. It is not like that if patient is going there and doctor is doing a consultation, during that time doctor can say everything. They need to prescribe some lab reports also. Based on that lab results, they can decide that okay, what is the issue with the patient and what can be the further procedure for that. So for that, we have an integrated laboratory management system where we can create the request for the laboratories test, and based on the results we can directly see it on the related record. Let's say that from the appointment itself, if we created any lab request, we can see those related lab results at the same place. We do not need to jump into the patient or the laboratory menu to see those results. We can see it at the same place. Then we have a pharmacy, as I mentioned, that to go the paperless, we can have the integrated pharmacy. We have a beautiful dashboards also. So from the single place, we can get all the analytical data or the information about the hospital, that how everything is going on in our hospital. After that, we have online appointment booking flow also. So if we are going digital and if we wish that our patients can book the appointment from the website, we have option. We can allow the patient as a hospital to book the appointment from our website. We have a mobile app also. So from the mobile app also patients can book their appointments. They can see their previous prescriptions, surgery details and certification, consent form, everything. So all the medical records of the patient can be seen from their patient mobile app. Then we have a point of sale integration for the pharmacy. So if we are managing the pharmacy with the point of sale, they can directly complete the prescription order also from the point of sale of Odoo. They do not need to go to any other screen and then check it out that what is the prescribed medicine by the doctor. They can directly complete the order from the point of sale itself. We have an insurance module to manage the insurance details of the patient. We can manage multiple insurance policies of the patient that is totally dynamic, that is not integrated with any insurance portal, but we can have information about the insurance policy of the patient and insurance company, that which kind of insurance policy they have, what other rules are there. And based on that, we can create a claim to the insurance company and get the details. And based on the approval of the insurance claim, we can do the further billing to them. Then we have shift planning. Obviously, in the hospitals, that is one of the most important part when we talk about the triage or the nurse. So we have the shift planning module where we can plan out all the nurses, our other staff shifts very easily. Over here, we can use it from the community edition as well as enterprise edition for the same. Then we have subscriptions. So as I mentioned that we have multiple features over here. Subscription is not that much needed for all the hospitals, but multiple hospitals need to subscription flow also. So they can offer that, okay, if you have a subscription of 10 appointments or 20 appointments, you can pay in advance and after that you do not need to pay. And you will be getting multiple other free appointments and so on. So for these features we are using that. Majorly this feature gets utilized in the orthopedic sector. In the orthopedic, that patient knows that they have to complete these much consultations and so on. So for that gets used maximum time. If our hospital is bigger size, we can manage the ambulance also. All the fleet of our hospital can be managed with this. In the ambulance module, we have added the functionality to manage all their flows to commute from the patient location to the hospital or hospital to the patient location, and based on that we can have invoicing and related flows, and that history will be also managed over there. We have option to manage the blood bank if we have integrated blood bank in our hospital. Then we can do the digital certification also of the patient. So if any patient is ill and they need to give the certificate to their respective company or anywhere, we can generate such a digital certificate and then we can provide that. Apart from that, we have specialty related modules also. So for the gynecology, orthopedic, odontology, aesthetic, pediatric and ophthalmology, we have specialty related modules. So using these modules, doctors can have the extra functionality on top of default HMS flows. That helps them to manage their flows very easily. As an extra feature, we have an option to manage AMR flows. Then the HMS menu is there to manage, that is useful for the management. So they can see everything from the single place. Then we have a facility management also. So based on the need of the hospital, we can have a daily activities, whatever daily activities like toilet cleaning or the bed sheet cleaning and so on. So such a facilities can be managed very easily using this. We have another module is waiting screen. So in the waiting screen, we can show the waiting number of the patient who is waiting outside of the laboratory or outside of the OPD. Using this feature, we can give the more visibility to the patient that what is their number and when that they are going to be consulted. We can manage obviously that digital documents of the patient, that whatever lab results or the radiology results are there. So the documents can be used for that. And we have a WhatsApp integration also for the community edition. So these are the features which we have developed. But apart from them, that EHR or the hospital management system which we have is the prior or the superior to any other healthcare solution, because we have the opportunity of the innovation by doing further implementation or utilizing the further features of the Odoo. As I mentioned that using the different modules we can improve the efficiency of the resources. we can plan it out in advance for the OT, or we can plan out the advanced planning of the appointments and so on. And with our based experience, we can adopt the based approach also. That as we have implemented this solution in multiple hospitals, we know that what are the issues or the limitations they are facing and so on. So with our experience, we can help you with that part also. When we talk about the scalability and adaptability, that is a major concern about that. So that as our solution is built on top of Odoo, that it gives us the flexibility and option to manage the different settings. We have developed it in such a way that you can configure some flows without any customization. If, for example, let's say that some hospitals do the invoicing in advance. You have to pay in advance, and after that your consultation will be there. Or in another hospital, if you go there, doctor do the consultation, at the same time you can pay out. Or normally in India we see that, okay, first that you can do the booking or you can walk in out to the hospital, and after at the end of your consultation you have to pay. So for all those use cases, you do not need to do any customization. You can directly change the configuration in the configuration settings, and solution will be ready based on your need. So we have that flexibility to manage the different settings. As I mentioned, that all the modules are integrated with each other. So each department can have information very easily. Whenever any doctor completes a prescription, that pharmacy guy will be able to see those prescriptions before that patient arrives over there. So that integration of the different apps gives you the facility to manage your healthcare system very easily. After for that, we have the support of for the growth and expansion. As you know that Odoo is growing very fast or rapidly. Together we are improving our solution, so you can get all the benefits of the features or the enhancements, whatever are done in Odoo and whatever changes we have done in our solution. As I mentioned that it is built on top of Odoo, we can have all the facilities of the Odoo like the accounting, HR, stock, purchase. These are the normal operations which normally each and every hospital organization does in their daily activities. So that options can be used, and based on the need, we can offer them that that solution can be cost effective. If hospital wants to spend some fixed amount or the specific budget, then we can offer accordingly. We can offer them the specific modules also. We can offer them the community edition or enterprise edition also, as our solution is compatible with the both. And our solution is scalable, as you know that Odoo can be used for the micro level or the small level and the bigger industries also. Same way, we have done multiple installations or the implementations where we have done the implementation with the single doctor in the clinic, as well as we have done the implementation in the 400-bed hospital also. So that is the flexibility or the scalability which we get at our almighty HMS. As we have been working with this solution, at the beginning we worked with the different solutions and so on, and after that we developed our own solution. We launched it in 2018. Based on that implementations, we are currently managing 100 plus hospitals where we have successfully implemented our solution. In our all the implementation altogether, 2.1 million plus patient records are getting managed. We have 2K plus doctors who are using our solution, and we have 80 plus apps which gives you the dynamic option to select the features based on your need. So this is the proven record of our healthcare management solution. That's it from mine. Let me know if you have any question or any further queries for us.
Hi.
Hi.
Hi, I'm Dr. Patel from Law. We are a healthcare career platform. So, just want to know what if existing hospitals is using old software or software-based, and how do you help them their existing data to your new, if they adopt a new?
Yes. So Dr. Sandeep, based on the need, we can do the migration of existing solution also. Our first approach is always with the master migration only. We do not propose the solution to migrate all the historical data, but we propose that, okay, let's migrate the master tables of the patient, doctor, medicines, and other configurations, and we can start using the system. As they are using the current solution for few years, what we suggest that keep that solution running for few more months or for few more years. So if it is needed, you can check it out, the historical data in the previous system. But yeah, if they insist that yeah, we want to have all the historical data in the new system, we can help with that also. We can do the script or the imports and so on. But that is not work. So we have both the options. Based on the customer need, we can go ahead with that.
Which Odoo version have you built this? Like, which is the latest version that you provided for the clients?
Yeah. Currently we are running with the Odoo version 17. But our solution is available since version 9.
So when new version upgrade of Odoo, do we need to connect you to upgrade it? Like, what type of customization is required?
See, for the HMS, we normally publish our HMS apps within 20 days of new Odoo version release. So let's say that on the 2nd October, they are going to release a new version. So by the 20th of October or so, our HMS will be available. But for the migration, there are some procedures. That is very common for the Odoo, that you need to migrate your database, or if you have any other custom apps or so on, that needs to be migrated first, and then we can do the database migration. But for the database migration, we need to have enterprise edition subscription. If you are using the community edition, it would be not possible to get migrated.
So, are you providing solutions for both community and enterprise?
Yes, based on the customer need, we can provide the solution on the community as well as on the enterprise edition. We have a 50-50 ratio at the moment, that 50% of our customers are using the community edition.
So, is there a pricing difference, community versus enterprise?
Yes. There is a major pricing difference of the Odoo. Let's say that if you are using the community edition, you do not need to pay the licensing fee for each and every user.
Sure.
But for the enterprise edition, you are going to pay for each and every user. So that is the only major difference. In terms of the HMS, no, there is no difference. It is same.
So let's suppose if I purchase solution from you for the community version, in that case, do you have some limit of number of users I can add on my system?
No, there is no limitation. You can have unlimited number of users.
If you go with enterprise one, then there is a limitation.
Yes,
right?
there is a limitation.
Therefore,
And that will be sure that fixed price of the Odoo only. We are not adding any extra price on top of that.
okay.
Okay, thank you everyone. Let me know if you have any other question. Also, you can meet us at booth number 7.